Hello guys, now I'm going to talk about health issues related to the human nervous system.
First, multiple sclerosis. It is an abnormality in immune system that attacks myelin sheath in the brain and spinal cord. The damage to myelin sheath prevents the transmission of nerve impulses in the brain. As a result, communication between brain and other parts of body is interrupted. This is an example between a healthy nerve and a nerve affected by multiple sclerosis. Secondly, Alzheimer's disease. It is a neurological disorder caused by depletion of brain tissues or death of certain neurons and reduction in the secretion of neurotransmitters. This will cause the patient to lose their abilities to speak, walk, eat, read, and write. This picture shows the difference between normal brain and severe brain affected by the Alzheimer's disease. Now, moving on with Parkinson's disease. This disease is caused by the shrinkage of nervous system. It causes patients to experience tremors in the limbs, jaw, foot, and face. Patients will also face difficulty in maintaining body posture and balance due to weak muscles. Next, epilepsy. Epilepsy is an abnormal activity in certain parts of brain causes the nerve cells to produce abnormal signals. The person involved in epilepsy may be unconscious or have muscle cramps. Fifth, cerebral palsy. It occurs because of brain damage before or after baby is born. Cerebral palsy causes failure in muscle and ability of motor neurons to function properly. There are 4 types of cerebral palsy. Each part can affect different parts of the body of the person. Moving on, ALS, which is amyotrophic lateral sclerosis, are also known as Lou Gehrig. ALS is caused by deterioration and death of motor neurons that controls the movement of muscles, such as chewing, walking, and talking. This means motor neurons fail to send nerve impulses to the muscles. This picture shows that the affected nerve cells cannot contract the muscle. 7. ADHD, which is Attention Deficit Hyperactivity Disorder. ADHD causes someone to become hyperactive, unable to concentrate, and gets easily bored. The disease is caused by a defect in the parts of the brain that controls mood and emotions. Lastly, autism. Autism is a type of disease that related to the development of nerves in the brain. The disease can cause an individual to experience problems communicating and interacting and expressing themselves, such as being happy. Now we will proceed to effect of drugs and alcohol to human coordination and response. First of all, stimulant drugs are also known as stimulants. There are many types of stimulants such as cocaine, anabolic steroid, and Adderall. Anabolic steroids is usually taken by athletes or anyone looking to build muscle fast. For Adderall, it is commonly prescribed drug used to treat patients with narcolepsy and ADHD. However, it is commonly abused among teens and young adults for studying or taking tests. Stimulants can increase the activity of central nervous system. However, excessive use causes temporary euphoria, which followed by depression. Next, sedative drugs or depressants. It is a prescription medication that slows down brain activity and make you feel more relaxed. Depressants delays the transmission of nerve impulses and calms the mind. It is commonly used to treat conditions like anxiety and sleep disorder. Third, hallucinogenic drugs. It can cause users to hallucinate and relieve from pain and anxiety. The drug can change the way a person sees, hears, and feels about a situation. Fourth, narcotic drugs. It is also known as opioid pain relievers. The drug is used for pain that is severe or cannot be helped by other types of painkillers. It delays normal function of the brain. Lastly, alcohol. Alcohol disrupts the coordination and thinking. It also delays the transfer of nerve impulses.
Hello everyone, now I want to talk about health issues related to the human endocrine system. So the first one is diabetes mellitus. The diabetes mellitus patient does not produce enough insulin or cannot use the insulin produced. As a result, the level of glucose in the blood is high. The patient urinates frequently, always thirsty, experiences numbness in the soles of the feet, has blurred vision, tired, and their wounds heal much slower. Whereas the excessive secretion of insulin causes hypoglycemia, where the blood glucose level is too low. Among the symptoms of hypoglycemia are fatigue, difficulty sleeping at night, disordered thoughts, fear, emotional instability, faints easily, and headache. Next one is diabetes insipidus. For diabetes insipidus patients, the posterior lobe of the pituitary gland fails to secrete the antidiuretic hormone, ADH. As a result, patients will produce a large amount of urine and often feel thirsty. Since a large amount of water is lost through the urine, the individual will experience dehydration if they do not drink enough water every day. The next one is hypothyroidism. An adult will experience hypothyroidism if there is inadequate thyroxine secretion. Symptoms include extremely slow heartbeat, extremely sensitive to cold, tiredness, and gain weight easily. Next, we have hyperthyroidism. Hyperthyroidism refers to a situation that occurs when too much thyroxine is secreted. Symptoms include excessive sweating, heat intolerance, increased frequency of defecation, fear, heart palpitations, and weight loss. Sometimes the thyroid gland will grow 2 or 3 times larger than its original size. Other than that, there is gigantism. Excessive secretion of the growth hormone GH during childhood causes gigantism, which is a condition characterized by the abnormal elongation of bones. The individual that experiences gigantism grows to become extremely tall. The last one is dwarfism. Low secretion of the growth hormone GH during the period of the growth delays the growth of bones and causes a condition called dwarfism. Organs also fail to develop and parts of the body ratio remain as that of a child. Thank you.